Listen to how stupid mainstream media sounds talking about Trump appointing RFK as the Secretary of Health and Human Services. Listen to this.
The New York Times describes him like this, as a, quote, environmental lawyer who has no medical or public health degrees and has promoted anti-vaccine conspiracies for years, end quote.
Because we definitely trust the New York Times. Like, there's no way the New York Times is paid off to push a certain narrative. Like, come on, guys. We live and breathe the New York Times.
Regarding the Food and Drug Administration, the agency that is responsible for the safety of our prescriptions, vaccines, cosmetics, our food, even veterinary medicine, an agency that would be under his purview, RFK has said that, quote, entire departments have to go.
Because that would just be so bad. Like, us taxpayers definitely don't want that to happen.
Let's bring into our breaking news coverage former Obama White House Policy Director, MSNBC medical contributor, Dr. Kavita Patel. Dr. Patel, your first reaction.
Oh, my God. I mean, those of us who have spent our lifetime, kind of decades working in and around in HHS, I'm not kidding, Nicole, my texts are flying off the chain, both Democrats and Republicans saying this can't be real. Someone must have gotten this wrong. This can't be possible. And now the second underlying chain, there's some silver linings. The second thought I had is he can't get confirmed, can he? But I'm just listening to you talk about the DNI and all these other roles that require some sort of White House or confirmation or some combination. And here we are. It is really hard to believe. There are career staff texting me saying this was just the push they needed to try to get out. They were already on the fence and worried. We're not just going to see this incredible kind of integration of ideology that has no science behind it. But Nicole, we're going to see probably the best of the best career staff leave.
Oh no, doctors that wanted to quit being a doctor are now going to use this as an excuse to quit being a doctor. I'm pretty sure that's better for all of us if someone that didn't really want to be a doctor and was thinking about quitting is now going to use this as an excuse to quit. Like, I wouldn't want them taking care of me if I'm sick. And if RFK has no science behind his claims, I mean, he's consistently attacked these big pharmaceutical companies over the years and all their products. How come he's never been sued? How come he has never been sued one time in his career? I mean, he's lying, right? He's spreading misinformation, right?
Leaving these agencies potentially hollow that he would oversee.
Just for people that aren't familiar with how HHS interacts with the medical community and people's lives, just take us through a little bit of that, if you will.
Yeah, so the Secretary of Health and Human Services, as you mentioned, has a purview over many agencies that touch our lives. You just touched on a couple of them: Food and Drug Administration, the CDC, Centers for Disease Control and Prevention. You may kind of know these letters as we've talked about all vaccines and things during COVID, but it touches everything. Nicole, touches our food supply chain. I'll give you an example. When we had a supply chain shortage of baby formula, this hits a lot of people at home because none of the shelves could keep the formula stocked.
Lady, our fruits and vegetables are layered with pesticides. Our grocery stores are shelved with ultra-processed foods. We have 9,500 ingredients that aren't in European foods, in our foods. I'm pretty sure there's more important issues than baby formula. Kids are out here waking up and taking in high fructose corn syrup for breakfast, and this lady's talking about baby formula.
HHS secretary kind of pulled it all together and worked with other departments to try to make sure that we could get Americans formula just to feed their children. Add into that just all the research. Think of the National Institutes of Health, Nicole, that's also under HHS.
Because we definitely trust the National Institute of Health and all other similar institutes. There's no way they're paid off by these big pharmaceutical companies to push their products and narratives. Like, what? No way.
Research on drug development. And I actually pulled up, just to remind myself, a tweet from RFK Jr. when he was running for president, where he said that if he were president, I guess thank goodness he's not, he'd stop research on drug development and infectious diseases for 8 years. And I think he was proud of that. So anything that you do in the medical community, and then let me tell you where it hits home. During COVID, you and I have talked about the Medical Reserve Corps and the Public Health Service Agency, all the people who actually help to facilitate getting vaccines across the country, getting COVID tests across the country. That's under HHS as well. So anything from a safety net clinic to the medicines that you trust are safe.
We definitely trust these medicines. I mean, I eat these medicines for breakfast, lunch, and dinner. I love medicines. I trust them with all my heart.
That is now potentially going to be under this environmental lawyer with no training whatsoever and very dangerous views.
RFK is literally the only dude to raise awareness about health in the mainstream media. Like, if he's such a conspiracy theorist, if he's such a lunatic, why isn't this lady or why hasn't anybody been screaming about our health as our health statistics are worsening and worsening? How come we've never heard anybody else offer a solution? Like, you offer something. Don't just call him a lunatic. This lady is literally branding herself as a supervillain.
I have a little one, so I'm on a vaccine schedule again, and I trust my pediatrician with that.
That was a little weird to say publicly. Okay.
RFK has criticized childhood vaccination schedules, linked vaccines to autism and other health issues against studies. CDC Director Rochelle Walensky warned in 2022 that vaccine misinformation is one of the biggest threats to children's health. In the sort of pickled community of anti-vax disinformation, there are people that refuse vaccines, and there are outbreaks of polio and measles in this country, diseases that were once thought eradicated. What should people watching do if they have young kids?
I do think that if there is any solace, it's what you just said, that as doctors, we're trained. So we are trained. I know that we've talked about doctors in many states not being allowed to talk about certain issues. I really hope and pray that vaccines and public health do not become another set of issues in addition to reproductive and women's health. But right now, your pediatricians, your primary care doctors, they have your best interests. They treat you in front of them, and they're not worried about the politics. In fact,
oh yes, because they care about each and every one of their patients. It's not like they have a quota of certain products that they need to sell out of their certain medical offices each month. There's no way. Like, come on, guys. Whatever my doctor or pediatrician tells me, I'm doing it. I'm not asking any question because I know for a fact they care about me and my future. They love me.
I bet most of my medical colleagues don't even realize what's happening because they're doing what they should be doing and taking care of people.
Or it's because they live in a dream world where they think their industry isn't dominated by financial incentives, so they'd rather ignore it.
So I do think that it's worth just having that direct conversation with your pediatrician. And I also do encourage people to look at the evidence. I do not try to dismiss people when they talk to me about concerns about vaccines, but it's worth bringing back up that initial study that has been since debunked and refuted. And in fact, journals have retracted any of the mentions, not because they're afraid, but because we want to put good science forward.
Okay, that was a generalized, vague statement. What study? Go into specifics, please. Please go into specifics and provide the study. But yes, I agree. Everybody do your own research.
And Nicole, I'm all for telling you that we could probably do things differently. I know that I've talked with my own pediatrician, with my children about, do we need to do all of these vaccines in this one visit? Can we spread it across 2 visits?
Heck yeah, man. Give me all the vaccines right now. I want them all right now. I'm going to eat them all for breakfast. Yeah, baby. Oh, yeah.
All of those conversations are appropriate, but that is not what we're talking about. That's not what RFK Jr. is talking about. He's talking about implying a direct causality between vaccines and autism. And in addition to that, other claims that we have. And then he couches it by saying he's not anti-vax. He's just anti all the vaccines that we currently have, which is effectively being anti-vaccine.
Another lie by this evil supervillain. He is not against all 72 vaccines that Big Pharma recommends children take. He's against a lot of them, and he just thinks we should look at the data and see which of the 72 vaccines that we should give to these kids should be taken out of the schedule. Are all of them really that necessary? That's all he's saying. He is not against all vaccines. That is not true.
That he has been really pushing this Make America Healthy Again agenda as part of really what helped Donald Trump get elected to the White House. I cannot tell you the number of people who liked the fact that RFK was involved in the campaign, that they liked the messaging that RFK put out there, despite the fact that it is so controversial, and despite the fact that there have been so many things that RFK has said about health that are just simply not proven by any studies that we have. So,
because we definitely trust these studies and the institutions that publish these studies. I mean, it's not like we're the biggest spender on healthcare in the world, and we're one of the unhealthiest countries in the world per capita. I mean, they've been just going so great for us. We love this, and we trust those studies.
Of course, the question now is going to be whether or not RFK can actually get confirmed. One of the things to keep in mind here as we talk about this, RFK is not a Republican. He has been a Democrat. He has been an independent. He does not have the same ties to the Republican Party that someone like even Matt Gaetz has. So whether or not these controversial opinions, these just downright not accurate.
Thank you, CNN journalists, for giving your opinion on health. We're all going to trust you. None of us are going to listen to RFK now because you know that all of his opinions are not accurate. Thank you.
Opinions that he has when it comes to health are going to be something that make it through Congress. That's going to be a big question.
This is why I'm not getting too excited about Trump picking RFK to be the Health and Human Services Secretary. I mean, this would be amazing if it went through, but will Congress approve of this nomination? That is what we need to pay attention to, because if they do, if he somehow makes it through that, I'm going to be jumping for joy, as I'm sure a lot of you will. But that's the question here. That's the one thing the CNN journalist said that was right. I make sarcastic commentary on all news politics daily, so if you enjoyed this video, click the subscribe button, and love you all.